actually recruit
Nurses especially.
Oh, yeah.
nurses. So we can't force anybody to do anything, but there is a way of psychologically motivating people. You know, if you tell them you don't have to go home, you can stay, we'll give you a job, and you can get a lot more money than you would at home. Well, the other countries can't compete with that.
And here's our problem is, our kids who should be nurses and doctors are dropping out of high school.
Yes.
Or not completing college. I mean, so we've now wandered into the education agenda.
Which is part of, and that's what we do, is we're trying to encourage young people, especially from disadvantaged backgrounds, to get interested in healthcare. And we start out with elementary schools and all the way up to college. And it will take all of us to make a difference. But we have to do something about it. We can't ignore this huge deficit in workforce because we're not taking care of our own. It's not that I have any objection to anybody from another country to come and work here. That's not the issue. The issue is we're neglecting those who should be working in healthcare, that should be nurses, because we don't do too much about the education system either. So it can't be just healthcare. It has to be education, workforce development, the whole thing. We have to have a holistic approach to everything.
Can I add something to this? A question to everybody, just interesting on UW on campus. What do you think, which university do you think is the #1 provider of PhDs in America today? Just a tip, just a guess.
All PhDs
University
en
of
masse?
California.
UC Berkeley, you say, yeah, UC Berkeley.
California.
No, Tsinghua University is the #1. Who's the #2?
What was number one? Tsinghua.
Tsinghua in Beijing.
China.
Yes.
Oh.
Who's the #2?
Or China.
China. I think, is it Tsinghua is Beijing, I think. #2 is Beijing University, #3 is UC Berkeley, number 4 is Seoul University. So it's just, it goes right into what you were saying.
Okay, but
People like
let's work backwards a little bit. Where were these other countries 5 years and 10 years ago? They were putting in, they could see the need for this, and they were somehow instilling into the young people there the idea that you can make something of yourself. You can do better. It has been my observation that in many, particularly the Asian families, I mean, education is an absolute, they just will not settle for anything less than a good education. They demand that their children have that. I don't see that so much in parts of our country.
We need to take a break so that you can refresh your drinks and get something to eat, and then we'll come back and work on what we've got up here and mold it into a number of recommendations, or however you want to deal with it.
Just something for somebody to think about while we break is, I think there's only about 5 or 6 things on this. It kind of travel all over the place, but there's only about 5 or 6 things on the list that aren't addressed in some way in the Obama health platform. And so we might be able to point out those, the ones that we think are missing from the Obama platform. Others are definitely elaborations or more detailed descriptions of what could be that.
Yeah.
Just if that's a useful way of thinking, it
Well,
might shorten out.
we have different alternatives for dealing with these issues that are listed on the agenda. You can simply support or not support items in the Obama agenda or the 2004 platform, or you can state a goal but not necessarily provide the information about how to solve this problem. I mean, state a problem but not necessarily provide the solution, or you can actually formulate in well thought out language a position and recommendation on policy issues. So why don't you just take a break to get some more